The students in the medical laboratory technician program, they're on an 18-month track to learn how to work in a clinical laboratory. They're going to study things like hematology, chemistry, microbiology, and blood banking in order to be able to work in that environment. They're licensed after they complete our program, provided they pass a national exam, and then they can work anywhere in the nation.
For things like micropipetting and stuff, I want to make sure that they're getting those skills and they have the hands-on experience and know how to do that. So I will help them one-on-one with that.
You learn so much, and the professors are all super nice and knowledgeable. They actually work in the field, so they get to tell you about what it's like. And then you go on a field trip, you go to see what they do and things like that. So it's really amazing.
We will do our laboratory experiment, and then we will break up and discuss the experiment. And many times we'll also have case studies that we go over, which they seem to enjoy that, because that gives a real world perspective of what we're learning.
From her experience, she brings in things that happen at her lab and problems that you can encounter, and then you get to figure out how to troubleshoot that.
So the more that they troubleshoot, the better they're going to get at being able to think outside of the box. It's very important in our profession to be able to think outside the box. Every day is something new.
When you're done with all the didactic learning, you actually get to go into clinical rotations, and that's like a full-time job. So you will be 40 hours a week for 23 weeks, so basically 6 months of a full-time job. And we like to tell our students that that's a 6-month interview, because a lot of our sites do hire their intern.
I'm really excited about going on to the clinicals. You know, usually when you choose your career path, you kind of want to try it out before you actually do it. And after taking these classes here, you are so prepared.
The best reflection of our program is the fact that every student who's gone through our program has passed their national exam. Our students meet the highest standards in the nation. They go above and beyond what's required for California, and so our clinical sites, when they get students, they're always impressed, they're always happy with who they've gotten. The reason this is exciting is because you get to help people, but sort of behind the scenes. You don't have to be on the front lines doing direct patient care. You can actually help people behind the scenes by looking at their lab results. You kind of feel like a detective of the body. You're the first person to see that someone's having a heart attack, and it's your determination, really, that sets whether or not they are or not.
And there's many times where we're rooting for the patients. You know, it's heartbreaking sometimes, seeing what's going on, and, we're working very closely with the doctors and the nurses. So, to us, it's important to make sure that we're treating every specimen as if it's somebody that we love.